I got this call. He calls me really urgent and he's all frantic and he's like, there's a patient in the ER and they're bleeding out and we got to go take them to the OR and fix their arteries. And I'm like, okay, click.
From PAStartup.co, this is the PA Startup Podcast, a podcast dedicated to helping pre-PA students, current PA students, and new grads start their careers as physician assistants. I'm Chris Darst. Today's show is a day in the life of an orthopedics and plastic surgery PA. This is my friend Shannon Korth. We've been friends for a long time. I actually met her when I was a PA student a long time ago. I was on my orthopedics rotation, and she was a tech in the operating room for a lot of our cases. And we got to talking about PA school and what I wanted to do after graduation. And she had been on the heart team, and I kind of wanted a job in heart surgery, so we kind of hit it off from the beginning. But she was a tech for quite a while in orthopedics, and then she moved back to the heart team. So we got to work side by side for a long time, and she expressed to me her interest in going back to PA school, finishing her prerequisites, going to school. And it was really fun to watch her journey, to kind of watch her see that the profession was something that she might like and kind of set her sights on it and go chase it. If you are new to the PA Startup Podcast, welcome. Thank you so much. Check out our other episodes. If you're a returning listener, great to have you back. Thank you for your support. There's some great shows coming. We've got Day in the Life of an ERPA, what not to do your first day of work, how to stand out in the first 100 days, and PAs owning their own practices, which is not a uncommon thing, actually, as it turns out. Definitely check those out, and if you would, subscribe to this podcast so new episodes are delivered right to your device whenever I get my butt in gear and get them posted. As always, if you have questions for the PA Startup Podcast, please shoot me an email, questions@pastartup.co. Some of you have asked how you can support the PA Startup Podcast. If you'd head over to the website, pastartup.co, check out the things there. There's an Amazon link. There's a store where you can get some sweet PA Startup swag. And don't forget our Audible sponsorship, where you can get 1 free month of Audible completely free of charge, and you get to keep your book at pastartup.co/audible. Enough of that. Let's get into the conversation with Shannon Korth in her day in the life, actually a week in her life, as an orthopedics and plastic surgery PA. All right, Shannon. She's taking a drink. Perfect timing. Mm-hmm. Mm-hmm. Welcome to the podcast.
Thank you.
Have you ever been on a podcast before?
No.
No? No one's listening right at this moment, just so you know.
Good, it's not live.
That's right. It's not live. You can screw up if you want. Now, one thing, take your phone out. I didn't tell you about this beforehand, so this is a total curveball. Yes. Look at your text messages and open up your emojis, and I want to know what your top 3 emojis are that you use in conversation.
Is it on the row or is it in the column?
The left side, the top going down. It's vertical. Oh. I think.
The red heart, ooh, a smiley face, and the pink hearts where there's 2 of them.
You sound like my wife. Yeah. It's the heart eyes, the kissing, blowing kisses or whatever. Yeah. Okay. So 2 hearts and a smiley face. You're a happy person then.
Yeah.
All right. I've had other people that it's the fist or the middle finger or
the revolver.
The revolver, the pile of poop. Yes, we've had everything. But all right, thank you. That just gives us a little glimpse into Shannon. So, all right. So Shannon, we've known each other for a long time, actually.
Yeah.
We worked together. I don't want to steal her thunder, so I won't tell her story. But let's start with, now you work in orthopedics, right?
Yes.
Orthopedics and plastics, is that right?
Yes.
Okay, we'll get into that's not a typical combination, I don't think, is it?
The hand aspect, it's a plastic surgeon that specializes mostly in hand, but also does plastic surgery, cosmetics.
Okay, an orthopedic surgeon that specializes in hand and then plastics of the hand? Mm-hmm. Okay, gotcha. I was picturing like a shoulder replacement and then going into like a breast augmentation. So
right. It's true.
Okay.
We do have days like that.
Oh, well, okay. All right. Well, let's start at the beginning. So tell us your background. How did, like, prior to PA school, how did you decide on the profession? How did you decide that that was right for you?
Well, I'm a little bit different. I have a background in surgery as a surgical technologist. I've been doing that for about 20 years.
Wow.
Yep. I worked with some really awesome PAs, some role models. They kind of laid the groundwork for me, and I always try to go above and beyond my job. I would go home and research if I didn't understand something, and it was noticed in my work, I would say, and a lot of surgeons commented, and I got a lot of compliments, and always saying, hey, you should go on to PA school. And I took it to heart, and I actually pursued the dream. It took a while, but I did pursue that dream and became a PA. So
good. Now tell me, 20 years ago, did you see the role of PAs change in that 20 years? Like when you started, were PAs as common as they are now in surgery?
No.
Really? Did you know any back then?
I knew a few. When I did cardiovascular surgery as a surgical tech, there was always a PA in the room. And sometimes there was a surgeon and then there was a PA, but sometimes two surgeons did assist one another. Oh, and sure. I did see that in a lot of specialties other than cardiac. Mm-hmm. There was like, if you were doing a carotid or something with vascular surgeons, there was usually two surgeons assisting one another as opposed to a surgeon and a PA, which is what I see a lot more now.
Sure. Yeah, as time goes on, I think there's been more, at least I've definitely seen it in my 12 years. So, okay. Sorry, I didn't mean to cut you off. But
no, you did not.
So people encourage you to go to PA school. There were some other techs I know that you worked with that kind of went to PA school as well. Did that factor in? Did you kind of see them and then you're like, hey, I can do that?
You know, it did. I more envied them more than anything. And it was just something I was like, this is a dream. It's just something that's going to take a long time for me. I'm a mother of 3, and it's just a matter of balance. And I wanted to continue to work until I could get into PA school. And so I had to do a long, drawn-out process of a class here, a class there, but still kept my job up.
Sure. So your prerequisites were what I think it's 10 years is all they're good for, right? So
yeah,
you had to kind of start back over at 0 for your prereqs, right?
A few, but like the chemistries, I started because I was pursuing other career to get a bachelor's. That was one of my goals, and then it turned into PA. So it was kind of, I was transitioning to get a bachelor's of science degree. So I did the chemistries and got all of it out of the way, knowing that I wanted to do something in medicine a little bit more.
Okay. So you graduated tech school. Is that an associate degree or is it a certificate, or I don't even know?
It was a diploma back when I graduated, and then it became an associate's degree. Okay. And it was the year after I graduated that it did that.
Just missed it.
Yeah.
So then got it. So you went back to finish your bachelor's degree, right? And then those prerequisites crossed over. So once you decided on PA school, you had to plug the whatever's missing in. Is that right?
And I did have to retake a couple.
Okay.
But that was just 2.
Gotcha.
But that wasn't much.
Okay. So how'd you do that? Night class?
Online. A lot of online stuff. And I did have to talk to the college that I wanted to get into for PA school and ask them what specific colleges they take online classes from, because most of the classes they did not recommend online. And so I also had to get colleges that had different time slots. Like there was not really an online or a evening course for organic chemistry, that very fun course that we loved.
Yes. That I don't use at all.
No.
Really at all. I know what a ketone is, but that's about it.
Carbon is very
And
popular.
carbon is pretty prevalent everywhere.
Yeah, it's true. But yeah, so I had to take a class in the morning, and so I had to work with my schedule and kind of transition my hours and work with my current employer at that time. So
gotcha, to make time. Now, did the PA school not accept? Did they not recommend the online class because they didn't accept credits from that place, or because they thought that it wasn't a good education?
I think it was more that they didn't feel it was a good education.
Okay.
I didn't know the reasoning really behind it, and I don't know if they would have ever known.
Sure.
If it was online versus, because my transcript did not mention it anywhere that it was an online course versus a in-classroom course.
I guess that's true, because on the application it's just the course title and the grade, right?
It's true.
Oh, okay. Very good. All right. So you you took your classes, got your prereqs out of the way, went through the application process. How was that? How was that journey for you?
Taking the coursework?
Well, taking the coursework and then just applying, the whole application process. Did you apply to a bunch of schools? Did you know that with your family you had to stay local, or what was your thought process?
Well, with applying to a college with the PA program, that was driven by my family mostly, because I didn't want to uproot anybody. I didn't want to travel a lot. It was more inconvenient for my family. I wouldn't be there as often if I was doing a lot of traveling back and forth to a college. And so I basically applied to one.
Just one, because you were like, I got to stay here. Family's here. Yeah, well, good for you. Mm-hmm. All right, so let's talk about, school is school, and we know about the classes and the rotations and things. How did you structure your rotations? Did you know what you wanted to do when you were done, or did you kind of say, being from a surgical background, it suggests surgery, but did you say, I'm an open book, or were you like, I'm doing surgery?
I would say I was open there for a while. I didn't really want to set a goal yet until I had experienced a lot of situations and different rotations. So I wanted to kind of see what was out there. All I've known is surgery. And so it was kind of cool to see a clinic and how it runs. And it was very cool to see how the ER is run and floor work and doing rounds. And that's all outside of my normal that I knew from surgery.
Sure. Was there anything you hated in school? Any subject?
Psychiatry.
It's kind of I bless those who do it, but yeah, it's kind of a frustrating field.
It's tough because you don't ever feel like you don't get that same satisfaction of helping a patient. You just have to medicate them and treat the illness more than see them, I guess, cured. You can't really cure them.
You kind of
and
just
that's very disappointing for me.
Yeah, minimize the complications, basically. Yeah,
true.
All right, so you're getting close to graduation. All of your rotations were local as well. Is that right? Did you tell me that?
Yeah, that's true. We had to have one rural, and I think I did a little reverse psychology when I was picking my rotations. I figured if I tell them that I have children, or they knew I had children, but if I tell them that I can't obviously do an outside rotation, then maybe if I don't tell them, they'll just keep me local, and they did.
Oh, nice. Perfect.
So it worked out. My reverse psychology worked.
Good. Excellent. All right.
But I did have a lot of providers that said, hey, I'll take you, and I did give names. Good. Because not all of those providers were in the list of providers that were used for preceptors.
Gotcha. Okay. So, that's a good tip too. If you're looking for something local and they're not in there, sometimes you just have to ask. And especially if you've worked in the hospital, you probably knew a lot of people by that point, right? Mm-hmm. Okay. Sweet. All right. So you get to graduation. What happens next?
Well, I had an unusual rotation year because I actually was offered 2 jobs and I had 5 months to go.
Oh, wow.
In my rotation. So it was almost scary because I was like, what if I find something else that I like in my rotations? But at the same time, it was very flattering, I guess, to know that 2 providers wanted to take on a new student.
Yeah, for sure.
So I was interviewing and negotiating contracts while I was in school, which was stressful. But at graduation, it was more or less, I had already decided on the career, which was with the hand and plastic surgeon. And the other position was a colorectal general surgeon. And so I did not go with that profession. So I chose the plastics. And so when I graduated, I just really wanted to get started. And so I took about a week or a week and a half off after my boards and just started working for the office. They gave me an option to just start learning the EHR and their system in the office. And so it was really nice because I obviously couldn't be paid as a PA just yet because I didn't receive all my credentialing and things like that. So it was handy because I got to know the office a lot quicker, I think.
Yeah, that's a good idea because it takes a while for you current PA students or I guess pre-PA students. It takes a while to get, when you graduate, you have to wait, I think it's 2 weeks before you can take boards, and then it's probably 2 weeks before you get the results. And then if you have an employer, they have to submit everything to insurance to get you covered, to the hospital that you're going to work at to get privileges. It takes a good 3 months to get up to speed. So if you can find a place that will let you come in and start learning the ropes, even if you're not getting paid a full salary, did they pay you for that time?
They paid me a wage. It was an hourly wage until I
Gotcha.
could get my PA credentialing done.
Because you're not functioning as a PA, so that makes sense. But it's kind of nice to get in there and kind of get to know people and get to know stuff. Cool. Okay.
Yep.
Awesome. So, about the 2 offers that you got, were those both people that you did rotations with, or were they just people that, like the colorectal and the hand surgeon, were they both people you'd spent time with, or were they people that just knew of you?
The hand and plastic surgeon didn't know me, but he got a referral or a reference from another plastic surgeon that I had worked with.
Gotcha.
So it's always good to be exceptional around those because they're always watching you.
It is a job interview every single day on your rotations.
Sure is
a job interview, because the medical community, especially if you're doing your rotations where you want to work, we all talk. And so that's awesome. So you're living proof of that. So
Yeah,
sweet.
It's true. The colorectal surgeon I had just worked with before and knew me.
Okay. Gotcha. Okay. Anything else?
With goals, I was just, getting better at my job. I would do still some more research. I mean, in PA school, I didn't learn a whole bunch about the hand, and orthopedics is pretty much every extremity when you learn that class. And so I just had to focus more on the, all of the anatomy of the hand, and there's a lot.
Yeah.
And there's so much out there for treatment for certain diseases. So I just did a lot of research and did articles and read those to figure out treatment plans and kind of wrote my own down.
Gotcha.
To have a good...
Keep notes and a little cheat sheet or something.
Yeah.
How much, as a new grad in a pretty specific specialty, how much education did you get that was kind of driven towards you understanding things? Was it purposeful, like, let's sit down and talk about this? Or was it, hey, we're just going to do cases and you're going to learn as you go?
No, he actually sits me down in his office. We still sit down in our office at the end of every week and just talk about what the next week's going to entail, what cases he wants me to study for. Initially, there was a lot of going into a patient's room with him, and he would question me about anatomy, or what do you think is wrong, x-rays, helping me read the x-rays a little bit better and understanding some deformities that you could see in the hand. He's a very patient man that I work with, and he's very intelligent and good at what he does. And so it was really nice to have him be so patient and willing to teach me.
Yeah.
And it was very nice.
For sure. Cool. How long did it take you to feel proficient? I mean, you could go in and talk to a patient about their procedure or their issue and feel confident about what you're saying.
I would say I'm not proficient in a lot of the types of injuries that you can have with the hand. But there is some that are really common, like carpal tunnels and trigger fingers and distal radius fractures. Those things we treat pretty commonly. I'm pretty comfortable with those. And I feel like I knew those within a couple of months of seeing a few, because when you have a lot of repetition, that's where you start to pick it up.
Yeah, for sure. For sure. Seeing the same thing. Now, do you work with just one surgeon?
I do, but there is always that chance that you can round with other doctors or have to scrub with them. And like we have a PA out on maternity leave, so I take her place every once in a while when I can and scrub with her surgeon.
So it's how many surgeons are in the practice?
There's 4.
4. And how many PAs are there?
3.
3. Okay. So is one surgeon always without a PA, or are there people that float between other people and you happen to just be with one?
I'm usually with one, and there's another girl that's specifically with another one. It's because their caseload is a little bit more dense than the other 2 providers in the office. So that PA is pretty much divided up amongst those 2 providers, the third PA.
Gotcha. Okay, cool. Do you like being with just one person?
I do.
Do you?
It's nice when you have something so extensive, like a specialty such as this, like the hand. It's nice to be with one provider. I think initially it's good because then you get a lot of repetition and you get to know their treatments and their plans and their orders and things like that. It's just nice. But I think it would be nice to branch out later on when I'm more comfortable. Yeah.
I think you're right. I think learning from one person, you kind of get to know what they expect or what they want. But some days it's nice to have variety. In my world, it's learning 3 different ways to do the same thing and then learning 3 different ways to manage the patients afterwards. And it's interesting. Surgeons don't always recognize that there's a different way to do things. And so they're like, what are you doing? I was like, well, that's what Dr. So-and-so does. And they're like, well, that's stupid. Okay, got it. Moving on. So, all right. Very good. So tell me about your typical day. What's you come into work, and what's a day look like for you?
Well, my typical day, I'll give you a week. I'll give you a perspective of a week, because most of our days are half-day clinic, half-day surgeries.
Every day?
Uh-huh.
Oh.
Every day except for Fridays. We do surgery all day on Fridays.
Okay.
So our clinics, we have a half a day, and it's usually about 3.5 hours, and we can cram 25 to 30 patients in that three to 3.5 hours.
Oh, man.
It's very busy.
Okay.
Do a lot of cortisone injections. I've learned that. Cast application, splint application, a lot of testing for certain things like carpal tunnel. There's a lot of testing that can go involved. It's really involved, more involved than I learned in PA school, to be quite honest.
Yeah.
I also learned to read the x-rays and do a lot of ordering, and we're just getting a OR in the back room up and running, and so I've been doing a lot of ordering supplies for that, and because of my surgery background, it's really a nice thing.
Yeah, for
to
sure.
Have,
so you're gonna be able to do procedures in the office, like a little bit more involved than typical office type procedures, really?
Right, more local, nothing that will require an anesthetic or even sedation.
Okay.
So nothing like that, but we just do the typical local procedures like a fingernail, taking a fingernail off, or doing a carpal tunnel, just some smaller procedures.
Wow. So, wow, a carpal tunnel in the office. That's pretty cool.
Yeah.
All right. Do you guys see people together, or do you see post-ops and they see new patients, or how do you break up the amount of patients each clinic? Well,
it's kind of different for me being new. He likes me to go in and kind of do the work them up and try to look them over and ask them questions, try to figure out the diagnosis, and then present to him just like I did on my rotations.
Yep.
I'm really practiced up in that.
Yeah.
So anyway, go see them, and then also do post-ops. But he generally likes to see all of his patients. And it's not to be shallow or anything, but it's more of a productivity for the office. But he does like to bill, and he bills higher than if I were to just see the patient.
Gotcha.
So if he sees every patient, then he can bill that he saw them all.
Right.
And so that's a more profit for the office.
Yeah, and I think that's pretty common actually for a lot of clinics. A lot of people, they'll go in first. A lot of PAs will go in first, kind of get the story, and then that streamlines things when the doctor comes in to see the patients. But then, at the same time, there's other clinics where it's completely independent, where, I see all the follow-ups, the surgeon sees the news, and we high-five at the end and go get something to eat. So,
right.
So then are your clinics always in the mornings?
Mornings for 3 of the days of the week. And then afternoon on 1 day of the week. And the afternoon one is usually swamped because nobody can ever come in the morning. They're working.
Oh, gotcha.
So the afternoon clinic is really busy.
Okay.
We also do have one specialty clinic out of town, and we do that 2 times a month. And that's usually just a morning or an afternoon where we book some surgeries at the same time while we have a clinic going.
Oh, wow.
So I usually am closing while he goes and sees 3 patients in the office and
comes back in. Yep. Does another case. Yep. Now, how far away is that from where your home office is?
It's about 45 minutes.
Okay. All right.
Yeah.
So you're not flying anywhere here. My first job in general surgery, the surgeon I worked for was a pilot, and he wanted to get his flight hours, but he combined it with surgery. So we would do an outstate clinic, but it was like if we drove there, it'd probably be 6 or 7 hours, but we could fly. I don't know, was it that far? 5 or 6 maybe, but we could fly there in about an hour and 15 minutes. And he had a plane, and I was scared to death. I don't know, of these little 4-seater planes, but the first day, it was the wintertime, and we get there, and he goes, "Hey, do you have a credit card?" And I was like, what, am I buying gas or something? And he's like, "No, I got to scrape some ice off the wings." And I was like, "What?" So we're out there. It's like 5:30 in the morning, and we're scraping ice off of the plane wings. And I was like, "I am going to die. This is going to be terrible." So I'm glad you were driving. I mean, I don't know. In the Midwest in the wintertime, it's probably not great, but okay. So
his driving is to be somewhat desired.
Oh, he drives. All right.
He drives,
Ooh.
yes.
Okay, maybe flying with ice on the wings is safer. I don't know. But all right, so of the I assume morning clinics, then do you have block time at different ORs in the afternoon, or do you just add cases as they come up?
Yeah,
how do you
he
plan
generally
the
does.
surgery schedule?
He generally does. Mondays he does usually do a outpatient. There's usually a surgery center that he goes to frequently, and he uses that facility a couple times a week. And then he does do a lot of his bigger cases at the main hospital.
Okay.
Where they know his stuff, they have his instrumentation, and they have all those bigger sets that he needs.
Is that always a set day, like Wednesdays or something like that he does the bigger cases, or is it kind of as the schedule allows?
If the schedule allows, basically, we do take call. And so when he's on trauma call during the week, I don't take call like overnight for him, but we do see patients because he does take facial trauma call and then also hand call. And facial trauma could be any facial fractures that were received in a motor vehicle accident, a fight, just anything. So we do a lot of that.
Wow.
Uh-huh.
That's cool.
Yep.
I mean, it's fascinating.
It
might not be
is.
real cool. It depends on the situation, but
It's true.
but
True.
that's nice variety for you.
It is a lot of variety.
And then tell me about the plastics part. Is that the facial injury ones basically is plastic surgery, and then the hand is the orthopedic portion? Okay, gotcha.
And then the facial, we do like laceration repairs. We also do a lot of lesions, believe it or not. A lot of lesion excisions.
Really? Okay.
Yep.
Like cancerous, precancerous.
And fixing the defects after cancer's been removed via Mohs or...
Oh. Okay. Very cool. How many different places do you go? Like
4.
Four hospitals or surgery centers? So are you driving
Maybe
a lot?
5. If you, yep.
Are you driving a lot, do you think, during the day? Do you feel like you are?
I do. I think I do. I can go to 3 or 4 places in one day. It's not uncommon.
Wow. That's pretty crazy. Do you like that?
Yes and no. It's the 5 minutes of freedom I have
Yeah.
getting from one place to another, but at the same time, it's a lot of driving, and I'd rather be in one location, but it's not bothering me if that's...
Yeah. Gotcha. Yeah, that was the time that I would call my wife for, whatever I needed to do that day, whereas now I kind of have to find time. And I never know what the weather's like outside because I'm always inside, never looking out the window. All right, anything else you think about your typical day?
Call, just that I do take one call weekend a month.
Okay.
I don't do any, and sometimes maybe 2, it just depends, but it's usually just 1. So 1 a month is what I signed up for. But
Are they pretty busy? Do you feel like you're always working? Is it a guaranteed?
No, if we have any patients in-house, I just automatically round. That's just a known thing. If you have patients, go see them. If there's consults, we kind of talk to each other a lot on the weekends. You want that weekend to regroup and not talk to anybody you work with.
Yeah.
But we still talk on the weekend and just kind of organize, say, hey, I'm running into town. Is there anybody you need me to see? Is there a consult? Did you get any calls? And we just touch base on and off all day throughout the weekend. Yep.
Okay, cool. Tell me about your role in the operating room. What all do you get to do?
My role in the operating room. So I get a position. I get to do first it starts out pre-op orders. You do those. Then when it comes to the operating room time, I go see the patient prior to surgery. I kind of explain to them what we're going to do, things that they can expect after surgery, kind of educate them on their care before they receive medication so they remember. And I also mark the extremity. I put my name so that they know which extremity we're working on. When the patient's non-sedated, it's a good time to ask and make sure they know that they're having a procedure with the doctor I work with.
Yeah, that's funny. The way that I was taught was to ask the patient, what side are we operating on? And I would say 9.5 out of 10 times they look at me like, are you crazy? And I was like, no, I know, but I'm supposed to ask you if you know. So yeah, people always look at me like we're nuts, but it has happened where people have operated on the wrong site.
Right,
so
it's very important.
All right, so they get back to the room.
Yep, I help position, and I can even prep the patient if they're running behind. With my background, I've worked in these places before. I know where a lot of the equipment is. If they need anything, I go get it. I kind of alert them of what items they do or do not have on the table that we're going to need. Then I also assist the doctor throughout the surgery and give him good exposure throughout the case. And then at the end, I close. Okay. He does a lot of the... He likes to run a couple of rooms at the simultaneously, and so when one patient's finishing up, he likes the next one to be in the room. So when I'm closing, he's beginning on another patient. So it's really fast paced. I do like to do the dressings and things. It's fun, putting the splints on, and I get to do all of that.
Cool.
So it's very fun.
That's a lot. That's awesome. Do you have any crazy experiences?
Yes.
Are there any that you can share?
Oh, I think so. Okay. I think this is pretty nationally podcast that nobody's going to know this patient.
Okay.
I hope.
Well, don't use their name.
I
but,
won't.
But yes, it is internationally acclaimed podcast, by the way.
Nice, right?
I think there's been maybe 18 reviews on iTunes, so I think I think it's pretty wild.
Nice.
No, yeah, go for it. Just don't use any patient names.
No, won't do that. So I was on call with my provider one weekend, and I got this call. He calls me really urgent, and he's all frantic, and he's like, "There's a patient in the ER, and they're bleeding out, and we got to go take them to the OR and fix their arteries." And I'm like, "Okay." Click. I'm like, okay, I'll go right there. And I hurried and I got to the hospital. The guy literally was bleeding from his wrists.
Wow.
And the story, interesting enough, this guy was hanging out of his window at home. He had busted through the window. He was eating glass.
What?
He was eating glass.
On purpose?
And on purpose. And he had multiple self-inflicted wounds to his head, neck. Both of his wrists and arms were tore up from glass.
Whoa.
And it was crazy. When we got to the ER, he was intubated, so there was no obtaining a history, and I don't think it would have been accurate anyways.
Sure.
But later I find out the patient was positive for THC meth. He has a diagnosis of paranoid schizophrenia. He was in the psych ward afterwards. Initially, he was in the ICU, and he was very combative. He threw his SCD machine at the window in a patient's room where the patient was trached and awake, and they couldn't talk, but he's in their room throwing things.
A different patient's room.
A different patient's room.
Okay, solid. Yeah, so he
was very high maintenance, very extreme sort of mental illness that we were talking about earlier, the psychiatric illnesses I didn't want to...
Your favorite. Yeah, exactly. Holy cow. So what were they doing when you got to the ER? Were they just holding pressure on his wrist to keep him from bleeding out?
They had a lot of Coban, a lot of 4x4s packing everything. When we got him to the OR, it did take us about 6 hours to repair all of his lacerations.
Wow.
He had severed 3 or 4 tendons in each wrist. He cut so deep. He had a big 2.5-inch piece of glass removed from his radius. We had taken it out.
Wow.
He had multiple sites on his neck. I was so worried about like vessels, but they weren't concerned at that time, but we did fix a lot.
Oh my goodness.
He missed everything, all the nerves, but he hit a couple of arteries that we had to repair and tendons, and then at least 20 plus incisions that we had to close.
Wow. And this is all from kind of being high and a little paranoid schizophrenia, breaking windows and okay.
Oh, it gets better.
Don't eat glass.
Don't eat glass.
Don't do THC or meth.
Right.
Probably more meth than THC, but I mean, who am I to say? We haven't legalized marijuana here.
Maybe that's why he's eating the glass.
Maybe.
Sure.
Huh. Okay.
But it got better, afterwards. There's a lot of wound care involved, and I did a lot of notes on him. He was seen in our office a couple of times, and then we finally got a letter from the hospital saying we needed to change our records on him.
How so?
The patient had written in and seen all the things that we had written about his care, and he's like, I'm not paranoid schizophrenia. Nobody's ever diagnosed me with that, and I was not self-inflicted wounds, and I wasn't high, and it was just crazy. He's like, it was carbon monoxide poisoning.
Yeah. You hear about that all the time, right? Carbon monoxide poisoning, people breaking windows and eating glass, right?
Right. That's normal. That's what we do.
You're like, listen, between the two of us, one of us was of sound mind when you came into the ER, and it was me, not you. So, oh, no.
And the 20 other providers that took care of him.
Yeah, no kidding. And everyone holding pressure and things. Wow. That's a good one. That's pretty wild.
Yeah.
So let's rewind back to graduation. Knowing what you know now about being a PA, what advice would you give yourself either at graduation or even to the Shannon who was applying to school? Is there anything that you wish you would have known back then?
Oh, when I was graduating? Just really think about your options. If you're presented with some, early on, just think about them really thoroughly. Maybe even try to get some experience in their office with a rotation. Follow them around. If you can, shadow if you're interviewing places and see how their office runs. If it's something that you feel like it's up your alley and you want to do it, then you'll know. I mean, you'll get to see what your job would entail watching somebody else do it, I also say to excel at your career, don't really settle for mediocrity. That was something I just feel really strongly about. Treat your patients like you would treat your loved ones, or yourself.
For sure. It's easy to get caught up in the fact that it's a job, and you've got places to be and you want to get to your kid activities, or you've got plans with friends or something and you want to get out of here. But, this might be the biggest thing they're going through or have been through, whatever the situation might be. So, yeah, you got to treat them like family. And, how would I want to be treated in this case? I wouldn't want somebody rushing through and just being like, yeah, we'll see you tomorrow. I'd want someone to sit down and tell me what's going on. Which means I get home late a lot, but
right.
But I mean, that's why I'm here. So that's all good. Cool. Well, anything else you can think of?
Oh, I will say, if I'm in being in such a busy clinic that we have, I'm just basing it off of what we were just talking about. I do make sure I spend the time with the patients and at least try to earn their trust really quickly. It's really good to be effective at that.
Yeah. Now, did you feel that that came pretty naturally for you, or did it? Good.
I did.
Good.
I felt like it was really easy.
Yeah. Sometimes they don't really teach bedside manner. And so for the listeners out there, I hope you have it. But if you don't, look for people that do have it and kind of model what they're doing, because poor bedside manner is a deal breaker for a lot of things, for jobs, for providing good care, for everything. So cool. Awesome.
Yeah.
Very good. Well, thank you so much.
Yeah, no problem.
Well, good luck to you. And I guess you're going to, because of the widespread popularity of this podcast, you're going to be a star in Dubai here pretty soon, I bet. Not really. All right. Thanks a lot.
Yep.
There you have it. That is my conversation with Shannon Korth, PA in plastics and orthopedic surgery. Show notes from today's episode can be found at pastartup.co/episode 28. And there you'll find links to our Audible trial, to the pastartup.co store, and my contact info if you have any questions. Join us next week when we circle back with one of our previous guests, Teresa Broder, and talk about a day in the life of an ER PA, emergency medicine PA. So don't forget to catch that episode. And guys, I hope everything's going well for you. So hang in there, keep working hard, send me any questions, and good luck to you, all right? Did someone just come in? We're sitting in like a dark conference center. It's a little weird. And it was freezing cold when I came in here and I turned it up. If you're hot or something, let me know.
Okay.
So sorry, squirrel.